Good morning, wherever you are. This is Talia Stone from ConferenceHype. Our segment will focus on chronic pain in sickle cell disease, a role for lysophosphatidic acid, from the 2026 July 30 edition of Blood. Background: sickle cell disease is a hereditary hemoglobinopathy characterized by persistent pain. Methods: here, we investigated the contribution of lysophosphatidic acid, an endogenous pronocystive lipid mediator, to chronic pain in SCD using humanized transgenic homozygous Berkeley mice that express 99% human sickle hemoglobin and control HbA mice that express normal human hemoglobin A results. Hyperalgesia in HbSS mice was associated with an increase in both plasma level of LPA and expression of LPA receptor 1 mRNA in L1 to L5 dorsal root ganglion. Discussion: our results suggest that LPA signaling may be a promising target for treating pain in SCD. From the 2026 July 28 edition of Blood. Background: immunotherapy has revolutionized the treatment of solid cancers in recent years. Methods: however, T-cell lymphomas originate from immune cells themselves and are biologically heterogeneous, rendering investigations of immune checkpoint inhibitor mechanisms of action complex. Results: mechanistically, PD-L1 blockade reversed TREG-mediated immunosuppression and increased the frequency of circulating effector CD8 plus T lymphocytes, thereby prolonging survival significantly. Discussion: our findings uncover CD4 plus T cells as key players in spontaneous and immunotherapy-mediated anti-T-cell lymphoma immunity, which demonstrates the critically needed preclinical proof of concept for the safe and effective use of immunotherapy for ALCL. From the 2026 July 28 edition of Blood. Background: patients in the lysocell plus ibrutinib cohort of the Phase 1/2 open-label Transcend CLL4 study had relapsed refractory chronic lymphocytic leukemia, small lymphocytic lymphoma, and received lysocell with concurrent ibrutinib from enrollment through 90 days after lysocell infusion or longer, per investigator discretion. Methods: patients in the lysocell plus ibrutinib cohort of the Phase 1/2 open-label Transcend CLL4 study had relapsed refractory chronic lymphocytic leukemia, small lymphocytic lymphoma, and received lysocell with concurrent ibrutinib from enrollment through 90 days after lysocell infusion or longer, per investigator discretion. Results: among 56 patients who received ibrutinib plus lysocell, median age was 64.5 years, 98% had high-risk cytogenetics, 55% had progression on Bruton tyrosine kinase inhibitor and venetoclax failure, and median number of prior therapies was 5. Discussion: clinicaltrials. Gov. NCT 033311198, NCT 034355796. From the 2026 July 28 edition of Blood. Background: current cell and gene therapies lack clinically practical mechanisms to selectively promote or suppress therapeutic cells in vivo, a limitation that is particularly acute in patients requiring ongoing immunosuppression. Methods: this includes gene therapy for immune dysregulation syndromes and antigen-specific or chimeric antigen receptor T-cell therapy for patients requiring immunosuppression, where both pathogenic and therapeutic cells may be suppressed. Results: focusing initially on gene therapy, prime editing efficiently edited loci of multiple pathogenic variants associated with immune dysregulation in primary human T cells, and corrected the HAVCR2 driver mutation in T cells from multiple patients with subcutaneous panniculitis-like T-cell lymphoma. Discussion: together, these findings establish multiplex prime editing as a promising preclinical framework for generating drug-controllable T-cell therapies, enabling selective in vivo modulation in settings where immunosuppression cannot be withdrawn.
This is Conference Hype. Stay with us, coverage continues.
From the 2026 July 29 edition of Blood. Background: light chain amyloidosis is a fatal plasma cell dyscrasia characterized by the overproduction of misfolded L or K immunoglobulin light chains produced by clonal plasma cells, which aggregate into amyloid fibrils that deposit in tissues and cause progressive organ damage. Methods: while current antiplasma cell therapies reduce the production of new amyloidogenic LCs, pre-existing fibrils persist and continue to drive organ damage. Results: 1F10 exhibits superior binding affinity to L-al amyloid fibrils and significantly enhances antibody-dependent phagocytosis of L-al amyloid compared with berdalimumab and anselamimab. Discussion: together, these findings establish 1F10 antibody as a promising subtype-specific immunotherapeutic candidate for targeting L-LC amyloid, addressing a critical unmet need for the majority of patients with AL amyloidosis. From the 2026 July 30 edition of Blood. Background: relapse after remission remains the primary cause of treatment failure in acute myeloid leukemia, underscoring the need for strategies to eliminate residual leukemic cells. Methods: in this randomized, double-blind, placebo-controlled Phase 2 trial, 128 patients in first remission received high-dose cytarabine plus modixafortide or placebo. Results: median relapse-free survival did not substantially differ between groups, 10.3 months for modixafortide and 11.5 months for placebo. Discussion: this trial was registered at as NCT02502968 and at UDRA-CT as 2014-002-70221. From the 2026 July 28 edition of Blood. Background: granulopoiesis is a tightly regulated process encompassing the production, maturation, and release of neutrophils in the bone marrow, ensuring their optimal physiological contribution to host defense. Methods: the mechanisms that maintain a balanced regulation of neutrophil effector functions during this process remain incompletely understood. Results: conditional erythroblast-specific depletion of ALOX15 decreased bone marrow SBM levels and caused altered neutrophil phenotypes, including augmented release of reactive oxygen species and neutrophil extracellular traps, as well as increased migration to chemotactic stimuli. Discussion: our findings establish a central role for erythroblasts and their SBM production in instructing granulopoiesis for balanced functional neutrophil responses. From the 2026 July 29 edition of Blood. Background: sickle cell disease is an inherited hemoglobinopathy characterized by chronic hemolytic anemia, painful vaso-occlusive episodes, and end organ damage. Methods: larger cohort studies are needed to identify risk factors for developing DDRCH and MDS-AML in SCD and to optimize cellular therapy safety in this population. Results: cases of myelodysplastic syndrome and acute myeloid leukemia occurring after cellular therapy for SCD and reports of an increased relative risk of AML in populations with SCD have raised questions about the association between SCD and clonal hematopoiesis, a recognized precursor state for MDS-AML. Discussion: larger cohort studies are needed to identify risk factors for developing DDRCH and MDS-AML in SCD and to optimize cellular therapy safety in this population. This is ConferenceHype. Stay with us, coverage continues. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 July 28 edition of Blood. Background: azacitidine plus venetoclax is standard treatment for older unfit patients with newly diagnosed acute myeloid leukemia. Methods: we conducted OPTIML, a prospective randomized phase 2 trial comparing 28D ven versus 14D with AZA for C12 in genomically agnostic NDAML patients greater or equal to 60 years. Results: the approved 28-day ven schedule is associated with prolonged cytopenias, causing frequent dose reductions and cycle delays. Discussion: certain subgroups may benefit from prolonged ven exposure, but these findings require validation in larger studies, especially as triplet regimens evolve. From the 2026 July 30 edition of Blood. Background: adult platelets are relatively enriched in immune-related molecules compared with neonatal platelets, but neonatal platelets express some growth factors and enzymes at comparatively higher levels. Methods: this makes a prediction of platelet-immune cell interaction outcomes in neonates a challenge, as they are likely dependent on the cell type and tissue environment at the time of injury or infection. Results: adult platelets are relatively enriched in immune-related molecules compared with neonatal platelets, but neonatal platelets express some growth factors and enzymes at comparatively higher levels. Discussion: these studies indicate that neonatal platelets have immune-limiting roles in the postnatal period by indirectly limiting T-cell responses, perhaps contributing to the adverse outcomes of platelet transfusions to neonates. From the 2026 July 30 edition of Blood. Background: intercellular communication between multiple myeloma cells and osteoclast precursor cells contributes extensively to the occurrence and development of myeloma-related bone destruction. Methods, however, key interacting modes, and the exchange substances involved in this communication remain unclear. Results: the conditional depletion of FLNA in mice suppresses podosome activity and reduces stiffness, traction force, and deformability in pre-OCs, leading to significantly impaired osteoclast differentiation and increased bone mass. Discussion: these findings highlight the critical role of MM-transferred FLNA in osteoclastogenesis and suggest that targeting TNTs may represent a therapeutic strategy to limit pathological bone resorption associated with MM. From the 2026 July 29 edition of Blood. Background: clonal cytopenia of undetermined significance is defined by unexplained cytopenias with myeloid-associated somatic mutations not meeting diagnostic criteria for myelodysplastic syndrome's neoplasms, yet carries a highly risk-stratified probability of progression to myeloid neoplasms. Methods: the clinical distinction between CCUS and lower-risk MDS is challenging because current criteria rely heavily on semi-quantitative morphologic thresholds, despite substantial clinical and molecular overlap. Results: the clinical distinction between CCUS and lower-risk MDS is challenging because current criteria rely heavily on semi-quantitative morphologic thresholds, despite substantial clinical and molecular overlap. Discussion: these observations highlight the need for further study of risk-adapted therapeutic approaches in this population and underscore the importance of prospective clinical evaluation.
This is ConferenceHype. Stay with us, coverage continues.
That's it for now for ConferenceHype's coverage of the July 2026 issue of Blood. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.